Hello, today we'll be safely showing how to administer medication. First, we're going to start off with the 6 rights of medication administration. With that, we're going to start with the right patient. We're going to ask the patient the first and last name. Does the order match the patient? Second, we're going to start with the we're going to do the right medication. Does the medication label match the order? Third is the right dose. Does the strength and dosage match the order? Do we need to cut it in half? Do we need to multiply it by any other right time? Does the administration time match the order? Before administering the PRN medication, we need to ensure specific time intervals have passed. The right route, we're gonna see if it needs to be orally injected or through an IV. Right documentation, we're going to document immediately after medication is administered. So after we do that, we're going to self-identify ourselves. We're going to knock on the patient's door, wait for them to answer, and we're going to walk in, introduce ourselves. Hello, my name is Marcia Williams. I'm going to be a nurse today. Then we're going to wash our hands. As we're washing our hands, then we're going to walk over to the patient. We're going to identify them. We're going to use 2 identifiers. We're going to ask them their first and last name, and then their date of birth. After that, we're going to provide privacy by closing the curtain. And then we're going to explain what we are doing, which is administering medications. While we're explaining, we're going to ask the patient, do they know if they have any allergies to anything? If the patient responds with a no, then we're gonna at the patient's bedside, we're gonna match the MAR with names of the meds as shown on the label with the patient's name. If needed to perform a pre-administration assessment, which is the pulse and the blood pressure, then we're gonna discuss each of the medication that we are giving to the patient, its possible action and its side effects. And today we're going to be giving the patient gabapentin, which is an extended release oral tablet or capsule. All right, and we're gonna, like we said, we're gonna tell them about the medication. The medication is to treat nerve pains. Its action is to prevent and control seizures. And its possible side effects is dizziness, drowsiness, nystagmus, or tremor. All medications have some type of side effects to them. All right, we're going to give the patient an opportunity to ask any questions about the medication before we give them that. We're going to administer the tablet where the patient is seated or the sideline position so that it won't choke or so they can swallow and it goes down properly. They usually administer tablets in a cup like this with the tablets inside. Some patients may just take the tablets, or some may pour them out in their hand. It just depends on the patient. You give them something to drink. It can be water, juice, anything that the patient likes to drink. We'll do that. And then let them swallow it. Take their time swallowing. Some can't take pills as good as others. And then we make sure the medication is compatible. But when we give them something to drink, we make sure the medication is compatible with it. Some things you cannot take with orange juice. Some things you cannot take with other things. So do that. And then we'll brown cow out. So we'll make sure the bed is at its lowest position, whatever we brought it up to. And then we'll bring the side rails back up. Make sure all the patient's needs are met, as if they need anything or if they aren't comfortable, put them in the right position. We'll put the call light near them. We'll put it close to their bedside that they can reach and ring for us at any time. we'll open the curtains back so they can see us, we can see them. And then we will wash our hands before we leave out the room. Once we wash our hands, we'll let the patient know that, well, I usually explain what I have done first and ask them, do they need anything else before I leave? And if they say no or yes, then if they say yes, then I would get them what they need. But if they say no, then I'll let them know that I'm here for them and they can contact me at any time. Thanks.